people in our society with heart diseases. A large number of patients die before they reach hospital. We know statistically that close to 20% of patients who have heart attacks do not reach a hospital. 1.3 million people have heart attacks every year in our country. I think it's important to go to the hospital, do an ECG, rule out a heart attack. You've not lost anything. Exercise, I think, is critical. Make sure that you keep at least 45 minutes or an hour apart for your exercise every day. I'm Dr. Thomas Alexander, Head of Cardiology at the Covai Medical Center and Hospital, Coimbatore. And I'd like to talk today about some of the problems that affect people in our society with heart diseases. So the theme of this year, the World Heart Day, is use heart for every heart. Now what do we mean by that? When we say use heart, we always associate the heart with all the good emotions of caring, looking after, and wanting to do good things to those in society. And the theme emphasizes how we should use our heart, not the physical heart, but really the mental heart that we talk about, to greater use in order to look after the heart of the people around us, our patients, not just our patients, but our friends, our family, and the people that we come in contact with. So the whole theme is to use our ability to empathize with those around us and to look after their needs, not just from the narrow physical point of view of their heart disease, but also look after the larger needs of those around us, of needs of our society in bringing out a better world for all of us. So one of the things that we've been thinking about for the last few years is the fact that a large number of patients die before they reach hospital, especially when they have a heart attack. And we know statistically that close to 20% of patients who have heart attacks do not reach a hospital. So that is a huge number when we talk about it. When we talk about the number of heart attacks in our country, we know that close to about 1.3 million people have heart attacks every year in our country. And if you talk about 20% who do not reach the hospital, they have what we call sudden cardiac arrest or sudden cardiac death before they reach the hospital. So the question is, how do we identify them? And two, if we were to identify this high-risk group of patients, what can those people around us, not just doctors or hospitals, but what can the general public, students, relatives of these patients, just bystanders who are standing and see somebody collapsing, say on a railway station or on the roadside, what can they do? And basically it is certain basic life-giving procedure, or what we call cardiac resuscitation, that people can do, that bystanders can do while expert help arrives. So somebody sees somebody collapsing, it's possible to do early resuscitation at that site while you call somebody for help or call the ambulance or call a doctor. So that crucial few minutes is so very important for patients to survive. It's called the chain of survival. And what we plan to do is to start a campaign so that we can teach lay public, That is, it could be students, it could be anybody, relatives of patients, it could be those who go to a mall, those who are in those. So we are planning to target the general population to train them on the basics of resuscitation, or the early resuscitation. What do you do when somebody collapses? How do you position them? What are the first things that you do? You call for help, and what are the steps that you need to do to keep the heart going? So this sort of training is something that we feel is very important for our society. We know that there are certain devices called AEDs, or automatic emergency defibrillators, that are available in public places. How to use them, but even before using them, what are the steps that the general public can do in order to resuscitate a patient who collapses? So this is a campaign that we want to kickstart with the World Heart Day, and we plan to train those in various schools and social organizations within the hospital, relatives of patients who come here. So these are the various things that we plan to do. It's not just a one-off event, it's something that we plan to do in a sustained fashion over the period of years, but we will start this campaign during the World Heart Day.
Who are the vulnerable audience and its impact on young population?
We've done a study, this is which looked at the age groups that patients develop heart attacks. Now, if you take the Western population, those less than 45 years constitutes only less than 5% of the population who have a heart attack. We've seen in this country that it constitutes between 20 and 25% of our heart attacks occur in patients less than 45 years of age. And this has a huge socioeconomic impact, societal impact, because these are young breadwinners who not just have a heart attack and the costs involved in treatment of heart attack, but many of them have sudden cardiac death. The 20% population that I said do not get to hospital, and this is because they feel, the youngsters don't realize that they are vulnerable to a heart attack, and therefore when they get chest pain or discomfort, don't often go to hospital. They think it could be anything other than a heart attack, and therefore do not get medical attention quickly enough to save the heart. The second problem is that once you have a heart attack, you must realize that a certain part of the heart muscle is damaged, and there are consequences to that. There is heart failure, so they may be unable to do normal activities. There could be rhythm abnormalities that require treatment. So it's going to be a lifelong treatment for them. So there are consequences. Even if a patient gets to a hospital in reasonable time, has medications to dissolve the clot, or has an angioplasty, there are medical issues that will linger on throughout their life. And therefore I think it's something to worry about, because in our country, if we say 20 to 25% of the youngsters are the ones who come with a heart attack, we need to see what can we do to prevent that, because it carries a huge social and economic burden, not just for the families itself, but for the country as a whole.
Causes for the cardiovascular disorder and mortality rate among young population.
What we have found is that many of these are lifestyle related risk factors. So when you take the older age group of patients, they might be usually those with diabetes, high blood pressure, or high cholesterol, or maybe those with family history of heart disease. But when you look at the younger population, very often we find that they don't have what we call the classical risk factors, but what they have is lifestyle abnormalities, exercise, looking after your diet, making sure you don't smoke, both active as well as passive. And again, to emphasize, there are times we see young women coming with heart attacks, and it's not because they smoke, but it's because their spouse smoke at home, and it's passive smoking that they get, and some of them come with a heart attack. So it's I think changing some of these perceptions in society about the importance of leisure time, of importance of relaxation, maybe doing yoga or meditation, especially if you have a very stressful lifestyle. I think making sure your body weight is correct, exercise time is set apart, and you do that. And of course, binge drinking and the other things that we find contribute to many of these things are things that we need to sensitize the youngsters in our society about the deleterious effects of these. There are 2 or 3 factors that you need to understand. If you take mortality of those who come with heart attack at a younger age group compared to the older age group, actually the mortality is less than that of the older age group. And this is because many of the comorbid conditions like diabetes, hypertension are not there in this population. But having said that, we often find that these youngsters get medical attention much later than those who have the traditional risk factors or the older age group. And this is partly because people with diabetes or high blood pressure or cholesterol, when they get symptoms, they go to a hospital immediately, while the youngsters feel that they can't have a heart attack or it's very unlikely that they have a heart attack, and they delay getting to a hospital. And that has consequences in terms of increased mortality. But if you were to take 2 people, one a youngster who has a heart attack gets to a hospital at the same time as an elderly patient with multiple comorbid conditions getting to a hospital, clearly the mortality is less for the younger patient because he does not have the other risk factors that go with it. But I think it is also important to understand that you need to get medical attention as quickly as possible when you have a heart attack, because time is muscle. When we say time is muscle, we mean time. The quicker you are able to reperfuse or open up the vessel that is blocked in a patient, that much of muscle is saved.
Symptoms for cardiovascular disorder.
I think when we talk about the classical symptoms of chest pain, this is something that all of us are aware of. But I think you must understand that the elderly patients and women often do not present with the classical symptoms. Some of them will present with excessive fatigue, some of them with giddiness, some may transiently lose consciousness, some may just have excessive perspiration or sweating. So these are unusual symptoms, but in the elderly and women, these may be the presenting symptoms. And I think it's important that people understand that if you have these symptoms and you have the risk factors for that, say you're a smoker, you're a diabetic or a hypertensive, you have high cholesterol, then these symptoms could indicate that you're having a heart attack. And I think it's important to go to a hospital, do an ECG, rule out a heart attack. You've not lost anything, but missing out and delaying going to a hospital can have consequences in terms of mortality as well as morbidity in the long term. Well, essentially what I was saying is during the acute event, there is all the risks of sudden cardiac death or not surviving a heart attack. But going forward, if there's been a delay in getting to a hospital, cardiac function can deteriorate. So long-term patients may present with recurrent heart failure. They can present with abnormal heart rhythm. So this is what I was saying, that they might require multiple hospitalizations throughout their life because of the damage that has been sustained during a heart attack.
Precautionary measure to have a healthy heart and life.
Smoking is an absolute no-no. I think fast food now and then is okay, but I think many of these IT companies that you see, you go to their canteens, it's all fast food that's available, and that's what people seem to enjoy. But I think it's very unhealthy. Try to go back to what we were traditionally eating. Exercise, I think, is critical. Make sure that you keep at least 45 minutes or an hour apart for your exercise every day, irrespective of how busy you are. Look after, see what your ideal weight is. And I think it's also important to make sure that your work day should be maybe 8 hours, maybe maximum 10 hours. And I think you need to draw a line and say that this is all that I need, time and space for myself to relax, to spend time with my family. And I think these are important things for youngsters to understand and to make sure that they lead healthy lives.